guys, welcome back to Medical Coding with Blue. Today's episode is all about what you should look for in a medical billing and coding program. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I got an email and I'm going to read this email. Thank you to the viewer who sent in the email. And I'm not going to respond to this email personally. This is going to be my response. So here we go. They said, "Hi Blue. I hope this message finds you well. I am currently working in healthcare as a medical assistant, and I have started my career in early 2023. We are in June 2023. I am an introvert, so I feel this is not the best fit or position for me since it requires patient interactions. I've been interested in medical coding for some time now since I know a few people in the field, and I would love to be a part of the healthcare industry still. I have been searching for courses and I have found some online courses such as Ed2Go or PenFoster, but I'm not sure what would be the best fit for me. I have a friend who is in health information management and she recommends a program, not going to say which one it is, and all the online reviews have been positive. My friend mentioned that she can help me study towards my exam, but if you have time to review this course, I would highly appreciate it and your feedback. I have been following your YouTube for some time now. I'm just very nervous to dive into this field because I'm not the very best at reading comprehension." All right, so here's the thing. I have always made it clear. When it comes to reviewing schools, I don't like to review schools. Number one, okay? Number two, I don't like to review schools because I haven't been to that school. I went to a trade school that is no longer there. The trade school that I went to has shut down, okay? And I always get that question, where did you go? Where did you go? But I mean, it's no longer there. And I did a video about Ed2Go and I did a video about PenFoster. What I did was I reviewed the website and I made that very clear. I have not been there. I don't have relationships with these folks. But what I did was I reviewed all the courses that they say they offer. Some were saying, what kind of books they use and that kind of thing. So I was giving my critique on that, on what they had to offer and things like that. I also said what I did not like about both of those programs. And people, it's a mixed bag because some people say, well, I did really good at the PenFoster program. Some people say I didn't do good at PenFoster. Some people say they did bad at Ed2Go, and others say they did really good. So it really has a lot to do with the individual. The problem with a lot of these schools online is that they are very fast and they are self-paced because you can technically learn medical billing and coding on your own. The problem is that a lot of people want to have that hand holding. They want to have that, okay, this is how you do it, that guided thing, where there's an instructor and they're guiding you. And that's really not the case 90% of the time. You are having to learn on your own. So it really all depends on what kind of student you are. And as far as how driven are you to do this? What is your motivation to do this? Now, there's a couple of things in here that kind of worry me because a person said that they've been following me for a while now, but they're still asking this question of, well, my reading comprehension is not good. I talk all the time about how important reading is. It surprises me that I still get the question from people of, is there a lot of reading? It's medical coding. It's all reading. It's 90% of what we do in a day is to read. It's not data entry. There's somebody out there, I know, because I keep getting those comments in, oh, they think that this is a data entry job. This is not data entry. Data entry is a very small thing of what we do. We're mostly with a clicky mouse and we are comprehending documentation all the time. That is what we do as medical coders. We review documentation. We abstract diagnoses or procedures, which means we look and we see if we can pick up a diagnosis or pick up a procedure. And then we make sure that the codes are entered in. Sometimes the codes are already selected. So in those instances, we are essentially auditing to make sure that those diagnoses and procedures are the most specific to that encounter or that procedure. And then, we correct it and move on, or we send a query to the provider for more information as is needed, okay? So reading comprehension is paramount to what we do. You have to have that. There is no negotiating. oh, Blue, I don't like to read, or my reading comprehension is not that good. Okay, if you feel like your reading comprehension is not good, then you need to work on that. That's something that you can work on. Reading is a skill that you can build on, right? It is like a muscle. Some people say, well, Blue, I started reading and then I get really sleepy and I get tired and things like that. So then that means that you have to switch up how you're learning. Not everybody can learn based on just reading a book, okay? So you have to be able to incorporate other things. Sometimes you have to incorporate videos. Sometimes you have to incorporate just working through the workbook. Something to keep and engage your mind, okay? But at the end of the day, you have to read, and you have to have really good reading comprehension. The good news is that reading comprehension can be improved if you are willing to improve your reading comprehension. If you're not, then this is probably not the field for you. The good thing about medical coding is that we don't have interactions with patients. Our interactions are typically with other medical coders, with the ancillary staff, or with providers, okay? And so it's all about communicating with them. So there's not a whole lot of like communication, not a whole lot of time on the phone. People ask me about that too. Are you on the phone? No. I mean, I get a few calls, but it's usually from like my boss or something like that. Sometimes I'll have a provider who calls me on the phone, but I mean, other than that, most of the time I'm there at the facility anyway, so I go to them and we have discussions face to face, which I think is better than being over the phone. But the things that you need to look out for in these programs is how fast are they trying to teach you. If they're saying that you can learn medical billing and coding in 4 months, you can learn it over a weekend, you can learn it in 2 months, you can learn it in a month, that is not a quality program. It doesn't matter how you sell it, how you say, oh, there's all the feedback is good. I would be suspicious about that too. Whenever I hear, and I've been propositioned before by some people who said, well, we have 100% pass rate in our program, and we would like for you to market our program to your audience. No, because I know that's a lie. You can't have 100% pass rate. You can't. There's always going to be somebody in a really good group. If you teach a group of people, there will always be at least one person who misses the mark. And only because everybody is different, they take pressure, they take like any kind of thing that's really serious differently. And so there's going to be times where you could be the best teacher in the world, but a student will still fail because they've got a lot going on in their mind, and they're letting that cloud their judgment instead of just getting in there and getting it done, okay? So even if I hear that a school has like a 98% pass rate or 80% pass rate, I still think that's good because those are realistic numbers. When I start hearing, oh, it's 100% pass rate, it's 100% wonderful reviews and things like that, I would be looking at, okay, they have a heck of a marketing team. That's what that is. So you have to look out for that. But I've been very clear about that in my shows, and I say that a lot, where you have to look at what it is that they're offering and know that you're going to have to do a lot of studying on your own. If they're offering you to go to school, it's a year's time, 9 months, 12 months, or 18 months. That's good. That's what you want to look for in a school, because that's a school that understands there's a lot to learn. It's not something that you can just rush through, okay? And none of the 4 main medical coding certifications, the CCS, the gold standard of medical coding credentials, the CCA, the CCSP, or the CPC, none of these require you to go through a formal program. So even if you are interested in pursuing medical billing and coding, you can learn on your own. I do have the independent study list and video. It's in the description box below. All you have to do is click on that link. It's got all the books that you need. All the books that I recommend are also in the description box. And so if you take the time to go through those, I mean, that can really help you. I've had numerous people tell me that they've gone through my personal recommendations for independent study and they passed. They didn't have to go through a formal program. They took my advice, took the books, did the studying like they were supposed to over 9 months, 12 months, or 18 months, and they passed. And they passed the CCS. So if they're able to do that, and these are people who are very motivated to study on their own, but there's going to be people who say, well, Blue, I am motivated, but I get kind of like discouraged when I'm on my own and I just need somebody to kind of help me. If you want somebody to be like accountable, you have to be accountable to that person. You think that maybe that would help you, then find a tutor. Find a tutor that you can pay to meet, so that way you can say, well, I'm going to meet with this tutor twice a month, and while I'm doing independent study, because I have all these books, I save the money rather than giving it to a school that's just like lighting your money on fire because, they try to teach me in 4 months, or they try to teach me in 3 months or 2 months. Guys, you can't, okay? Spend the money to get the books, learn on your own. Find a tutor that you like, that you can schedule time with, like twice a month, or maybe even once a week, and that you're seeing them 4 times a month, and then you use that as your accountability. And so that way that person can help guide you through those times where you're not really sure. Can you help me to understand these things? You can always do that instead of attending one of these programs, because the programs are going to give you whatever books they want to give you to learn on. And so a lot of these schools, and if you go to a school and they say, well, and you ask them, what are the textbooks? Who publishes the textbooks that you all are using for instruction? If they say Bucks, know that those are not good books. I know, in my opinion, because I have Bucks books, I am not impressed. I think that they are difficult for new medical coders to use because of the way things are worded in those books. That's just my opinion. Some people may have a lot of luck learning from a Bucks book, but for me, I just prefer the American Hospital Association, Nellie Leon Chizen, the ICD-10-CM and ICD-10-PCS coding handbook with the answers, because how are you supposed to know if you don't have the answers? There's 2 versions of that book, that's why I say. And then, of course, the CPC study guide. If you are taking the CCSP or the CCSP, the CCA, or the CCS, you can use the CPC study guide, okay? Because it's just published by the CPC, right? Or the AAPC. It's just published by AAPC. Sorry about that, guys. It's just published by AAPC, but it covers the CPT manual. We all use the same CPT manual. So if you think that you can't study from that just because it says CPC on it, you're wrong, okay? And I use that, even as a veteran medical coder, to help me to study for those other specialties that I have been away from for a while, when I took my CCS exam. So that's something that, it's up to you, but that's just what I would recommend, because I'm a book lover. I love books, and when it comes to knowing what tools are out there, when I see a school that is offering books from Bucks, that's a no-go for me. That to me says, okay, that's probably not going to be for me, because those books are not helpful to new coders, in my opinion, okay? But if I'm studying on my own and I say, okay, well, I have this, the AHA book and the AAPC book, then I know I'm good to go, because those 2 books are wonderful for teaching the fundamentals of diagnosis coding, ICD-10-CM, CPT, and if you're studying for an inpatient side, ICD-10-PCS. If you are not, and you are using that book, the ICD-10-CM and ICD-10-PCS coding handbook with the answers, if you're using it to study for like the CCSP or the CPC, that's still fine, because it still covers diagnosis coding, okay? You don't have to go over the ICD-10-PCS part. You can skip over that part and just cover the diagnosis coding, okay? So I think it's a good thing, all right? All medical coding programs should be including a medical terminology, anatomy, and pathophysiology course, pharma as well. That's very important, because these are key fundamental knowledge bases that every medical coder must have. And no, you cannot skip over that. No, you will not learn that in the program with the coding. I've heard of that too. People have said, oh, well, you don't have to worry about, taking a course like that. We teach you the basics here in the coding course. And the coding course is maybe 3 months or 4 months. Get out of here. That's too much to learn and too much to put on one person. And these schools charge thousands of dollars versus if you had listened to my advice and heard me when I said, if you want to go through independent study, do that. If you want to go through the school, find one that is not fast paced. Find one that goes a year, 9 months, 12 months, or 18 months. Find one that goes like that. They are out there. You can go to the local college. Sometimes the local college has year-long programs. But even them having an instructor, a live instructor, does not mean that this is going to be a good thing as far as like, I'm for sure going to learn medical coding. You're not going to know until you're into it. You're not going to know how that instructor is going to treat you as far as like, do they really understand how to teach adults? There is a difference between somebody who's just a veteran coder and somebody who is really good at teaching adults. There's a difference, guys. And sometimes people, I've heard them, they say, well, my teacher got after me. They were very frustrated because I didn't understand. The teacher's probably frustrated because the person didn't understand because they're either not explaining it in a way that is helpful for the student to understand, or the student themselves are not really paying attention like they should be, and maybe the instructor was tired of just repeating themselves, or they've tried to say it different ways and the person's still not getting it, and that's always a possibility too. So it really all depends on what's happening in this particular situation. But for people who are taking it seriously, you want to look for those programs that last 9 months, 12 months, or 18 months. Get away from these programs that are saying 4 months. Okay, don't go to those. If they say, yeah, that's how long our program is, or we do weekend studies and that's how we train our folks, and you can learn it too on your spare time. No, you need 20 hours per week of combination of the school time and your own independent study. You have to be able to do this for 20 hours per week until you get to your test date. And it doesn't matter if you have a full-time job. There's plenty of people who have full-time jobs. They got a house full of kids and farm animals and cats and dogs and everything else, and they still manage to do it because this is a priority for them. And if you want to get into this career field, that's something that you will do too. So you're looking for time, 9 months, 12 months, or 18 months. You're looking for quality materials to learn with. Again, if it is bucks, I don't really recommend it, but if that's what you're using and you say I learned just fine, then that's you. That's great. But you want to learn medical terminology, anatomy, and pathophysiology, and pharma. Those are very important. And of course, you need to know about medical law and ethics. And that is covered in a book as well. I have a book that's listed below in the description box that covers everything. It's highly, highly, highly recommended. So that's just something that you all can look at when you're looking for these programs. I don't know you as far as like, how do I know if this is a good program for you, or you're just nervous because you don't know if it's a good program? I've given plenty of alternatives where you can go the independent study route, or you can finish out that program that you're in, whether it is a fast-paced program or not, and then take additional time to study and use the independent study sequence that I have, again, in the description box below. The video is there, guys. The video is there. And use that video, use that link, because it has everything in the description box, the whole schedule. And, when people ask me for it, guys, it's free. It is there for you all. I don't ask you for anything, and you can use that to help supplement your studies. All right. And so that's just the thing. That's the whole ins and outs of it, guys. And for those that are going through these programs and they feel like the instructor is not helping them at all, then find a mentor who can help you for free, or find a tutor who you may have to pay out a few bucks to ask them questions, to get them to explain it to you. But maybe having that one-on-one time will really help you. All right. And so that's just something that, you ought to know, because nothing will be handed to you in this industry. Nothing. And it takes a lot of self-discipline to get out there and to study and to be able to learn these things. But it is possible. When I talk about the study schedules, when I talk about like how you can fit 20 hours in a week, 30 minutes in the morning, 30 minutes at lunchtime, 30 minutes in the afternoon, and then an hour and an hour, right? 2 hours separately. You don't go study for more than an hour at a time. And that's 3.5 hours. If you do that over 5 days, that's 17.5 hours. And then you have 2.5 hours on the weekend to study. And so if you can manage to do that, that's 20 hours per week. That person that is studying 20 hours per week is going to be a lot further ahead than the person who is only studying 20 hours in a month. Okay? So 80 hours in a month versus 20 hours in a month. There's a huge difference in knowledge base there. Okay? And so that's just what I would have to say. Guys, and I want to say one more thing, and it's going to probably hurt somebody's feelings. Please use common sense when it comes to these programs. If you have a school that is so hyped up that you cannot find any negative feedback out there, there's something wrong, because there's always going to be somebody who doesn't get it or who had a bad experience or something like that. There's going to be something off, okay? So think about that before you completely trust a school with a 100% glowing ratings. Think about that, guys. Just think about it, all right? Does it make sense to you? Does it? And again, interview the teacher for the school. If there is an instructor that is at the school that's going to be part of that program, you ask the school, can I speak to the instructor? And interview them one-on-one. You're giving them thousands of dollars and your time. They can answer your questions. If they cannot, then that just saved you. Then you know that you can go on to the next school. Okay? So just think about that. When you go over there and when you talk to that instructor, you ask that instructor, when was the last time that you were coding in the real world? There's going to be a huge difference between somebody who was coding 5 years ago in the real world and hasn't coded since in the real world, has only been a teacher, versus a person who is still working in the industry, in the real world, and is also teaching. There's a huge difference, because I don't have to say this to people who already know, but to people who don't know, evaluation in management has changed from 5 years ago, okay? And not only that, in 2015 was when we went into ICD-10. So if your instructor has not been in the real world since then, that means that the last time that they were around, if they were in early 2015, they were in ICD-9 times. Completely different code set from now, right? So ask them, when was the last time that you were in the real world? And this is not to confront them or to question their knowledge. This is so that you know who is teaching you. Number one. Number two, when you ask them, what credentials do you hold? If they only say RHIA or RHIT, if they do not hold a medical coding certification, again, I would be looking elsewhere, because RHIAs and RHITs, the Registered Health Information Administrator, the Registered Health Information Technician, those folks are designed to be our leaders and they are designed to be our instructors. However, they are not, their concentration of those programs is not in medical coding. It is in, leadership. It is in statistics. It is in human resources management. The coding portion for those two programs is very small, very, very small. And because of that, their knowledge about medical coding is going to come from a book versus somebody who has real world knowledge and who knows and can help you better to understand the nuances of what it goes on in these books and how to use the books and how to properly study so that you can pass and have that critical thinking versus somebody who is just teaching passing methods. How do we pass this test? How do we pass this certification exam? Well, let me show you some shortcuts. Let me show you process of elimination. Process of elimination will not carry you through entire exams. It's only meant to be used sparingly here and there for those ones that you really get stuck on and you don't have the time to look at those things. Then you use process of elimination. But if you're counting on that to get you to pass the exam, and maybe that you do, because maybe you're one of those people who's really good at taking exams. But if you do that and you get out in the real world, and you're going to find out real fast that it's not easy. And the employers are going to test you again and again because they need to know what your knowledge base is. And if you only passed a certification because you were able to do process of elimination, it's going to show in those assessment tests. Okay. So that's my advice, guys. You know, if you write me and you tell me you've been watching my channel, I know you guys have heard me before when I've said this. Do not go for these fast-paced medical coding programs. If you are in one right now, stick with it and use additional time after your program to continue to study. Find a mentor or find a tutor, somebody that can help you, all right? And there's a ton of tutors on LinkedIn, all right? So again, that's just my advice that I'm going to leave it right there. But it is a great field, and I've said it's a lot of self-study, but you can do it, all right? And if you need to work on your reading comprehension, work on it because it's critical. It's critical for us to know that. All right, so I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.